So the question is, should I be a certified nursing assistant or be a medical assistant? Which one? Okay, so very quickly, again, because I'm a CNA instructor, I do get some of these questions and I try as much as possible to answer them to the best of my knowledge. Okay, I don't want to mislead anyone and I don't want to definitely not give anyone wrong answers. If I don't have it, I will find a way to get the answers. So I'm doing this video and I'm hoping that this will help those that are asking. So, CNA versus medical assistants. Which ones have a wider reach? Which one is quicker to snap up? Which one gets job very readily? Well, I'm going to say a certified nursing assistant, and I'm going to explain to you why. This is what I've been telling my students in class. So I come here on YouTube and I just, give the same information out. It doesn't cost me anything to share my information. So when I first started getting these questions, I always thought the CNA had a bigger and a better job satisfaction. Can I use that, satisfaction? Or bigger and better job stability. Maybe not satisfaction. Okay. And I'll tell you why. So with the CNA, the reach is wider. There are many places you can work. You can work in the nursing home. You can work in the hospital. You can work in a doctor's office. You can work in any of those standalone surgery centers or surgical centers. You can pretty much work, even home health. You can work in agencies, the nursing agencies. I mean, the range is very far and wide. I mean, you become a certified nursing assistant and you just have such a wide reach, okay? You're sought after. People want you. People want you on their team. And there's a reason for this because your training essentially teaches you people skills, communication, how to encourage and manage independence of your patients. Okay. It teaches you how to prevent infections and all those nice things. Okay. So having said that, when you become state tested, meaning you go through the board of nursing assistants. I mean, that's not what it's called, because the Department of Health actually is the one that oversees the testing of nursing aides. But usually after you've been state tested, you go into a totally different stratosphere. You're like the cream of the crop. I mean, you become state tested nursing assistant. In whatever state you live in, you rise to the top. You're next to the nurses. I mean, you're like hot stuff. Okay, so having said that, so the next thing now I'm going to compare them to medical assistants. So the thing with medical assistants, and this is what I don't get, and I'm going to tell you why I didn't get it. And then even after interviewing medical assistants and certified nursing aides, I'm really, really convinced that you being a CNA, going the CNA route pays you better. So with a medical assistant, they spend anywhere from, 8 months to some places 12 months and even beyond. I don't know why, because I'm thinking that if you're going to be spending that long, 12 months and beyond, you probably want to just go into nursing school. However, okay, to each his own. So the medical assistance program is more expensive and it's more invasive type teaching, meaning they're taught to draw bloods. Did I just say bloods? Blood. They can do vital signs. They do all that, but they also do check blood sugar. They maybe some kind of treatments. Again, I did interview different MAs, and they said they didn't do a lot of personal care, though. Personal care as in how to transfer, basic nursing skills like transferring patients, and helping with ADLs. That is more the CNA route. However, with medical assistants, it was more, to me, this is how I see them. They're like administrative assistants in the medical field. Does that make sense? So you find a lot of them working in the doctor's offices. They work in the doctor's offices. And this is where it gets tricky though. Having spent all that time, okay, 8 months to 12 months training as a medical assistant, your area of work is kind of limited in that predominantly they work in the doctor's offices and maybe some of those standalone surgical centers. They're limited in working in places like even the hospitals, working in the nursing home, working in a nursing agency or home health, because that aspect of personal care is not there. Basic nursing skills is not there. If you think differently, maybe you have more information than I'm giving, please feel free to comment below, okay? Because I'm not an expert in this, but I'm just going by what I have talked to different people, and so this is what I found out. Another thing, I actually talked to my doctor about this, and I was asking him, would you prefer a medical assistant in your office or a CNA? He's like, I prefer CNA because I can always teach my CNA the things that my medical assistant does. And that is so true. There are those that are CNAs. They go into the doctor's office and under the umbrella of being working under the doctor, they are trained and then they get a certificate. That's what I tell my students. Make sure you get a certificate for whatever it is you're doing. Say, for instance, your doctor sends you out to a phlebotomy class or he teaches you under the nurse or whatever way it is set up. You make sure you get a certificate for that though, because that also advances your resume. It advances and it beefs up your resume. So a lot of times doctors even prefer to have a certified nursing assistant or a state tested nursing assistant. So in other words, you being a medical assistant and paying all that money, because the difference in payment for one is a lot, as much as maybe $1,000 more when you learn to be a medical assistant. And also the time they spend in school. In most instances, to become a certified nursing aide, at least the class that I teach is 2 weeks. It's accelerated. Okay, that's 2 weeks. Now, there are those that are beyond that. You have 4 weeks, you have 6 weeks, you have, I don't know, maybe 6 months. I don't know. But they're there. Okay, it just means you're not going to school every day. Maybe it's every Saturday. So it is stretched out. So having said that, the money for that is not as much as going for medical assistant training. Okay. Another thing I believe they're taught in medical assistant school is medical terminology, which you can pick up. You can pick up and you can know these things. Okay. I have certified nursing assistants working in doctor's offices. So in my doctor's office, there's a medical assistant there. And she's telling me she wants to go to a CNA school. And I'm like, why? She's like, well, because for one thing, it opens me up so I can work in more than one place. You coming in as a certified nursing assistant also helps you in my mind. Okay. I'm not saying everyone has to go through CNA to go into nursing school, but you're already on that path. Does that make sense? So that's the thing that I see there. Medical assistant versus CNA versus medical assistant. If you ask me, I tell people who come to me, do the CNA route. Just go ahead and do that. As opposed to spending more money and stay longer in school. And then the places you work are even more restricted. It is more restricted. As a medical assistant, you really cannot work in the nursing home. You can't work in the hospital. You cannot work with any of the nursing agencies, even if you want to pick up hours. You cannot do those things. You cannot, when I say cannot, there are no definites. You may be able to do certain things, okay? But it's limited. As opposed to when you're a CNA, a lot of these places want you anyway because you have been trained in personal care with ADLs, with basic nursing skills, as opposed to a medical assistant. A medical assistant, like I told you guys, is like an administrative assistant in medical subsection. Does that make sense? So hopefully this helps you, because I always get this. Sometimes students in my class, excuse me, they already started. They in my class are like, do you think, I don't know if I made the right choice. Maybe I should have gone for medical assistant. I'm like, no, honey, no. If what is it you want to do? And then they tell me, I'm like, stay here. You know, I would even say, like, I think in the state that I teach, for you to go into nursing school is a prerequisite for you to have your CNA. I don't know if they will accept an MA from you, a medical assistant certificate or diploma. They will not. Actually, I will tell you this. Again, interviewing my doctor and interviewing other doctor friends of mine who own practices, I asked them, would you prefer CNA, MA, or an LPN? They're like, to have an MA, they'll rather have an LPN work as an MA. Do you see what I'm saying? So where exactly is the niche for an MA? If they would rather have a CNA or have an LPN work as an MA. So it tells me MA is not that lucrative. Does that make sense? It's not, you're like, you don't have a lot of choices where to work. So CNA versus MA, I'm just going to say, stick with your CNA. You have a plethora of places to work. So I'm hoping this helped you. If you got bang for your buck, it's free, people. Just go ahead and subscribe, okay? Hit the notification bell and give me thumbs up. It really helps me with YouTube algorithm. So I will see you on my next video. Be safe.